Let's get started. Welcome, everyone. Nice to see you all. My name is Inga. We're in English. I'm almost speaking Dutch by default, which is kind of weird since I'm German, but okay. I'll try to stick to English. Hello, everyone. It's Wave, some kind of connection. Nice. So we've got the session on personal health train, decentral data analysis, and we're starting off, unfortunately, not with further introduction of each other, which stays kind of a weird thing in these online virtual spaces, but probably you have all seen the pitch of Gijs this morning about a year ago when we have officially launched the personal health train learning community during the Health RI meeting. And yeah, so that was one of the last physical meetings, I would say, very enthusiastic start of what is now still a very active community and growing community. And before I forget, I would like to invite all of you who is not joining yet to join our community if you like. Also in other meetings, not just today. So let us know, enroll on the website, whichever way you like. I am still playing a bit with Zoom, not so used to that, to see my own slides. Can everybody see the slides actually? Yes, great. So the background of why we're having actually a startup program to get the personal health train to speed is that all know that fragmentation of data and is a big challenge, and we want to use that data for to improve healthcare, for example, and for that we also need to be able to do analysis of decentral data, and that's what the personal health train is a mission to enable. So we're working on frameworks and the scope. So for example, one of the frameworks that we get to later is the set of agreements that Wouter will talk a little more about. And so we are hoping to help by that to scale up and long-term sustainable development as well, and actually facilitating knowledge exchange within the network as well. So we had some deliverables for last year, and that was, for example, starting up our active communities that is working very well. So we also published a collection of stories from experience of working with the personal health train from the field. You can find that on our website. And we're also diving into the world of data-driven business models. Broadening the network, since it's been very much focused on research coming from a health RI background, but much more into health support and healthcare. And now we're working still on the essay paper, why the personal health train development is important and what it can benefit us, and to get to a set of agreements which will help us actually getting started with the personal health train in practice. So this is the team, and you see some people, of course, but most of the people are not visible since that's the communities, which are a lot of people. So you can find our team on the websites and reach out to us if you want to be involved in one of the communities. And let's dive right into the set of agreements. And I will ask some questions to Wouter in a moment. Maybe first question to introduce yourself a little bit, and I will try to get a gallery view from you all over here. Stop sharing if I manage. And then please raise your hands if you have any questions as well. Well, welcome, Wouter. Could you?
Thank you very much, Inga. Thanks. I'll do the introduction of myself. Wouter Franke, as an advisor working at the National Healthcare Institute, or in Dutch Zorginstituut Nederland, and focuses around the problems, challenges we have in terms of exchanging information, using information within the network of the healthcare. And sometimes that's more from a standard point of view, standards, and sometimes more of the point of initiatives, new initiatives. How can we actually use them within the Dutch healthcare system? And Personal Health Train and Verreden was one of them a couple of years ago. Then still very, very small. It was basically a movie on YouTube, which was a really nice movie, but also not much more than just that movie. But I do think in the last, I think that was 3 years ago, maybe 4 years ago even, it has grown substantially, had a lot of initiatives, a lot of pilots, a lot of smaller projects, and the whole concept of the Personal Health Train has grown considerably. And like Inga said, I think now is the greatest challenge is to actually scale it, to make it scalable, to make it usable for so many more people, so many more organizations, and so many more use cases.
Thank you. So welcome. You're working on the set of agreements together with people from the community, of course, but can you maybe explain what is the set of agreements and why do we actually need something like that?
Yes. Let's start with the why. Why do we need some kind of agreements to actually use the Personal Health Train? And the main reason is it's inherently a distributed environment. It's the whole concept of the Personal Health Train is that you use other people's data sources to be able to do an analysis, train a machine learning algorithm, or maybe just ask a simple question. So it's a distributed environment, not just from the point of view that the data is distributed, but also that most likely there are different organizations in there. So the organizations are distributed. And we have to work together. And if that's small, you can do that based on the fact that I know Inga knows me, so we can work together. We don't need a lot of agreements. We have a more personal trust. If it grows larger, start to work on it, we might not know actually. You start to need to build different ways of actually making sure that everyone does the same thing, that everyone can trust each other. So a distributed environment is part of it. And another part of it is that we're working not just on a technical level. It's not just a technical system or a technical solution that we want to use, but it's also about the process. It's about organization. So in these multiple levels of interoperability, to actually make something happen, you need some kind of agreement on the different levels actually to be able to work. You're part of a larger concept in which agreements in the long run are necessary. And then the why, the what question. What are these? What is this set of agreements? It's basically the things you need to agree on within a Personal Health Train network. It's you have to agree on technology, but you also have to agree on things like who can actually join my network, who can't join my network, what are the criteria actually to join a network. So it's a lot about the things of what are the prerequisites to start working together, and how do we keep trust within the network. So the main goal of the Personal Health Train, if the set of agreements is trust, interoperability, and making sure that you can actually work with the Personal Health Train.
And that last thing, I can imagine that a lot of us can imagine challenges. Am I unmuted? Yes, weird. So once we are imagining to get started with working with each other's data, we can all imagine all the challenges that we encounter over there. But if you have one set of agreements, will that solve these challenges for all of us? And what kind of challenges do you encounter if you try to set up such a set of agreements for everyone, basically?
It's and the set of agreements are about shared understanding and they're about interoperability. But the biggest one of the things is we can't solve everything for everyone. There's in a way, work is always preserved somewhere. But what we try to do is create a generic framework for the agreements that you have to make, because there are definitely challenges. We're trying to make something that is generic, can be used everywhere, but still needs to be able to help people set up a personal health care network within very different use cases. They could be hospitals together, but they also just could be more in terms of the different care organizations, can be different people could be involved, the personal health records. So we don't know the use case that the agreements are going to be used in. But we also don't know the organizations that are going to use them. We're not sure about the exact data that they're going to use. Are they going to use anonymized data? Are they going to use personal data? So there are a lot of unknowns, actually, but we still want to make the agreements that they have to make actually to be able to work with the personal health train. So it's a struggle between making it generic enough and abstract enough to be able to cater for all these different scenarios, but also try to make it as concrete, as applicable as possible, so people don't feel like they have to start the whole press over again, but actually have something they can build on and say, all right, if that's already done, that's, I don't know, 50% of my work or 60% of my work, and I only need to do the rest of it. And I really understand the basis of the personal health train. I share the understanding of the concept, and I know really what I need to agree on with the organization that I want to form a work with. But like I said, it's definitely not, we can't solve everything. And we can't write the privacy impact assessments, but we can help them saying, hey, well, there are cases in which you need a privacy impact assessment. We can create templates for them, and that's a lot of things we can actually do. But it's, like you said, we can't do everything, unfortunately. We would like to, but we can't.
Well, you can maybe give some more examples of what kind of agreements we can think of. I'm going to look at the questions, which I can find in the chat. So if you have questions, drop them there, I would say. Do you still have some more examples in the meanwhile of what kind
of... It's, and maybe before I give a couple of examples, it's we've defined for ourselves what the guiding principles are and the criteria on which we base, do we need an agreement here, and how are we going to form the agreement. And those principles have to the more the things that we want to do from a broader healthcare perspective, the informatieberaad, the outcome goals of the informatieberaad. But it shares principles around fair data, it shares principles about the decentralized way of working. So a lot of guiding principles there as well. But examples could be that if you really want to use a personal health care network, you really, a lot of them are about transparency. You really need to state who is actually a member of this network, who actually has data, what kind of data is in there, who is allowed to question the data sent around the trains. The trains, they should be as self-explaining as possible, so people can actually have a look at the train, see what will happen with their data. A lot of the agreements is making sure there's transparency within a personal health care network, making sure with the transparency you can build on trust network, and that we still have that privacy by design that is within the personal health train, and agreements on making it in open ecosystems as well. So I think one of the other important guidelines are, we don't want to create a vendor lock-in, we don't want to create one large infrastructure or anything. We want to create something that is an open ecosystem where people can operate, where people can use personal health care network. So the agreements are about transparency, are about creating trust, and creating that framework in which a personal health care network can operate.
Right.
And this part of it is the organizational side of view. And then obviously, we still have the technology point of view. So also on the technology level, we want to make sure that it's clear actually how the data interactions are defined, how the authorization, the authentication processes can be arranged, and these kind of things.
Thank you. So before I ask the questions from the chat, I would like to take a screenshot because I'm so impressed by this group of people. Let's all show our most happy selves in this meeting. Thank you. I can still ask the people that are visible for permission whether I can publish later individually. But great, thank you. I saw quite a lot of questions coming by. So the first one is about the alignment with international agreements, so standards and so on, and how do we make sure that's happening?
Yeah. On one hand, the personal health train is it's not a purely Dutch initiative, but there's a lot of effort actually within the Netherlands that are spent on this way of working. And maybe that's one of the sometimes the challenges. So internationally, there are technological innovations that actually fit the personal health train concept, and there might even be European initiatives that are similar or have something similar in mind actually as a personal health train. But what we try to do is create a set of agreements for the Dutch environment while still looking at what happens internationally. So try to align them internationally, but also keep a focus on the Netherlands, because otherwise you can also start to start too large at once. So had too many people, you end up with no agreements at all. So our main way of doing that is creating a Dutch set of agreements while looking at the international efforts and see how that aligns and change when necessary, but still keep it small enough to be able to actually, well, make something and actually implement it as well.
And then we get some questions about how, to involve the patient representatives and in developing these agreements, and also how this will work from a perspective of patients and users, which I would guess and clients. So which don't always have to be the immediate users, of course, but maybe you can elaborate on that.
It's within the personal health train network. Obviously, the patients or the personal data, the individuals that actually provide the data can be just as much part of your network as anyone else. And the problem obviously always is then who is representing the persons, because you can't involve probably 1,000 people. You're not going to ask 1,000 people actually to sign a large document, but you might ask them for consent. But there are examples where a patiëntenfederatie or other groups of patient representative in the personal health train network and also have a say on what happens. So are part actually of the agreements of a personal health train network. So that's one way actually to involve patient representatives at least. But I do realize and recognize that in terms of personal health train, and that the P of personal, there's also still a lot of work to do actually, because it's a solution, it's about technology, it's about organizations, I can see some questions about end users. The actual person might be actually quite far away from that whole movement of things that happen. But like I said, I think you should involve them within your network, saying, hey, we actually have a representative of patients, representative of actually the people. So they're starting to get part of the personal health train network and part of the people that actually are the data owners.
I see a lot more questions.
Your question, and in terms of the set of agreements, by the way, sorry to interrupt you, Inga.
No problem.
Within the community, there are also organizations that actually represent or work from a patient's perspective, help to actually shape those requirements. There are initiatives that work with MEDMI approved personal health practice actually to create that personal health train environment. So there are several initiatives on how to actually involve clients or patient representatives.
So I see actually a very nice interaction going on in the chat. Yes, people, please feel free to to get connected with each other's initiatives as well. I see some nice connections starting over there. Kees van Bochhoven, you are asking a question which I don't entirely understand. Maybe you want to ask it yourself. I'm not sure if I understand correctly. Yes.
Well, we had a community introduction earlier in Health.ai, and there's these 2 use cases that were shown, which I think are also both present in the Vantage 6 framework. So one is I have multiple data sources, potentially in multiple countries. And now I want to do research where I combine these sources without, while keeping the data there. So that's a federated learning. But there's another sort of class of use cases which really involves the patients or the people which data is about and to which it really belongs. Or a group of patients that says, well, I would like to have all my data potentially across multiple institutions, but then typically in one country because that's where you live. And I think this first class doesn't necessarily require that you have any direct link to the patient. The second one obviously does. I was just wondering if there already are projects where we really have a direct to citizen-patient link.
There are definitely initiatives where there's a direct link to patients' initiatives. At TNO, there are several initiatives around that involve the personal health records as well. So the personal lockers, the MedMy initiatives, and where they actually use that data or look at the ways of actually using the data within a personal health trained environment to make analysis, or the other way around, to provide a person with more information actually around their diagnosis or anything, and have that feedback loop as well. So especially at TNO, there are initiatives around it. Most of them are in pilot forms and not necessarily in more operational projects already.
Do you see an overlap between the two? Because I think the MedMy scenario is clear with the PGO, but it's typically like different from the type of data and questions you would have in a research.
I see Yilda wanting to respond to that.
Yes, because I also in reaction to what Kees earlier said, it's really separated. I have an issue there because indeed this project that Wouter is referring to, Connect to Health Consumer, where also some of the other participants that are here on board are involved in, we have 2 use cases. One that's really focused on how to get wearable data connected in the PGO to clinical data. That's your second one. But the first one is connected to the second one. If you, for instance, want to do a digital twin and now know how do I look to people in hospitals, then you are looking at those vertically partitioned, horizontally partitioned data all over the country, for instance, where you would like to say, how do I look compared to an individual in all those catalogs and see how they progress in time. So that I think really shows that you have the interaction between 2 of those examples.
I would like to immediately highlight some of the challenges that you have. You will see multiple personal health trained networks starting, operating, but at some point they're going to be wanting to actually learn from each other. So this is where the real interoperability starts, to see actually if you have a network that focuses around the PGOs, the personal health records, and they certainly want to use a different network that's really more focused around research. Then we go into the areas of the interoperability, saying how can you actually use it? How can we enlarge a network, saying, well, we allow these organizations as well on our network to make analysis or to use the analysis that already existing. These are the really use cases that get really interesting, also in terms of value for the end users, obviously.
Yes, and we are working towards having this set of agreements more towards the end of this year. And I would like to invite you all as well to help us, make that set of agreements work in practice. Since, so such a set of agreement needs to be tested in practice as well. So if you want to try out whether it actually helps to support interoperability in your specific corporations, or you have any ideas, then please feel free to get creative in that sense and get involved. Johan, I saw that you still had a question.
Yeah, well, not a question, but also to chip in on the last point, actually, because indeed, let's say from an infrastructure point of view, we've seen two kinds of streams, right? One is for the more clinical one-to-one connection between the healthcare provider and a patient or a person, right? And that these infrastructures will build around these concepts, right? And that's what you see more in the clinical domain. With the personal health, we're coming from a different direction, of course, where especially on the if we talk about cohorts of data, then you talk about do we have, as an organization, also consent of the patients to participate in this research project? But what if, so therefore you see traditionally there are two different kinds of ways of operating, right? And that's also baked into these systems. But that's mainly due, and that was an interesting discussion with Sergei and some people last week, is what if you bring that consent out of these systems, right? So if you break the consent and how you give or how people can give access to something, if you split it off from the infrastructures, then it becomes less of a problem that one platform is purely for that cohort-based thing and one is purely for, let's say, transfer of clinical data left and right. Because it opens up, different perspectives on how to use data, although, of course, then these systems need to adhere what's now a trusted source to give consent and these kind of things. But it tilts the conversation then a little bit as well.
Unfortunately, I have to kill our conversation slowly because we're getting almost to the end of this session, but I would like to ask one more question to all of you, which is, could you give us an indication whether you think such a general set of agreements that you can use as a backbone to get to agreements with your corporation partners in setting up decentral data analysis will help you? Do you think such a generic set of agreements will help you? Is it necessary, or it's really essential, or you rather do without? Just like a gut feeling, a number between 1 and 10. I'm very curious to get a little bit of feedback from you in the chat, if you like. Just throw out a number in there that comes up with you. And while you do that, I'm moving on, if I manage. Can I? Yeah, I can move on to announcing a meeting on the 29th of April, which I would like to invite you to, in which we go a little bit more into depth of all the details of, on the one hand, a trust framework, but also this essay paper that I mentioned earlier on, why is the personal health trend important? And we come back to the set of agreements again. So please join that meeting if you like, and sign up for that on our website, or contact me directly, and follow us on LinkedIn and like and share. And now I have to stop sharing because I'm not so used to Zoom yet. We're almost at the end. I think we have 1 more minute. We have to have a friendly wave. But are there any burning questions? I think I see the reactions coming in. Burning questions? Otherwise, keep those numbers going. Great. I see all 8s, 9s, 10s. Great. Nice. All right. Thank you all. Thank you, Wouter. Thank you, everyone.
Thank you all.
Nice to see you.
Bye-bye.
Bye.
Bye.